Welcome back. Continuing on with another video with blood pressure, specifically hypertension or high blood pressure. I'd like to make this video, the title of this video is Hypertension, Lifestyle and Initial Medication Management. So we're going to talk a little bit more now about what to do, how to manage someone with high blood pressure. There are other videos that I've posted about what blood pressure is and why it matters, what the different stages are, how we check it accurately in the office, and so now we're going to talk a little bit about actual treatment of blood pressure. So first thing with treatment of hypertension, and this is the same in most of, in fact all of probably chronic medication management, primary care, lifestyle. It's if you do primary care and if you've done it for a while, sometimes the lifestyle recommendations can be not necessarily frustrating, but it can be frustrating, or you can become very cynical very easily about recommending lifestyle changes, just because they are so difficult for people to make, but yet they can be so effective. I always tell people that there's no medication more powerful than a good diet, as far as like diabetic management and those types of things. And so it's so important for people to have the right lifestyle things in place, and you can sometimes avoid medication management if they have it, but it can be frustrating, and sometimes you get to a point where for physicians and providers, nurse practitioners and PAs, it's like, oh well, of course lifestyle goes unspoken, everyone knows that they're supposed to exercise and everyone knows they're supposed to eat right, and so it can be easy to skip over that part of it and just prescribe, but I find that it is helpful to have conversations with patients, to talk with them, and you'll let them know specifically what are some lifestyle things they can do. And I think it's helpful to give them simple specific things, something to the effect of, well, you should eat right and you should probably exercise some. Oftentimes not as helpful as specific things that they can do, you can check up on and see if that helps. Now, as far as blood pressure is concerned, there's really two main lifestyle things that are known or have been shown to have a benefit: low salt, regular cardiovascular exercise. So let's talk about salt first. The general recommended salt in hypertension is less than 2,000 milligrams a day. Now, next time or sometime in the future, you should take a day or maybe 2 or 3 days where you look at every food label, you look up every bit of food you get at any sort of restaurant or anything. Try to stay within 2,000 milligrams a day. It's very difficult to do. 2,000 milligrams is not a lot of sodium, especially if you eat anything that's pre-prepared. Any sort of canned soups, vegetables, certainly sodas, things like that. Restaurant food, staying under 2,000 milligrams is very hard. And so I like to challenge sometimes my medical students and PAs that I supervise and that type of thing to, try it. Understand what it is you're asking patients to do when you say, hey, eat less than 2,000 milligrams of sodium. It is a recommendation. You should strive for it. It will help with blood pressure. It's a difficult thing to do. And I think the more they know that, then the more they're prepared to face that difficulty. So, low salt diet and regular cardiovascular exercise. Cardiovascular exercise is exercise that, simply put, exercise that increases your heart rate or gets you breathing hard. Sometimes it can be hard to help patients understand how hard they need to work to say that they did some cardiovascular exercise. Very frequently you'll have patients who come in and say, I exercise all the time. I work at a warehouse. I'm constantly up and down the stairs. I'm constantly walking. I'm a mailman and I walk 2 miles a day, etc., etc. And I always tell patients that any walking is good, any movement is good, any exercise is better than none. But an easy way to tell, am I exercising? Am I doing enough effort to make a difference in things like my blood pressure? And usually what I tell people as a general guide is, are you working hard enough and fast enough that you can't have a comfortable conversation because you're out of breath? And so if you go for a stroll in the afternoon and you're walking with a buddy and you're able to talk and just have a comfortable conversation, it's great that you're walking. Walking is wonderful. I wouldn't count that as exercise if you're having a comfortable conversation. You should be walking fast enough, jogging, doing enough exertion that you're breathing hard. Your heart rate's up and you're panting. You wouldn't be able to just sit and talk while you do it. So that's an easy way. I mean, there's heart rate measurements. You should have 80% of your max, or you should get it up above 120 or 140, whatever. But patients aren't walking around with heart monitors. They can count and calculate and all that stuff. But generally speaking, especially if you're dealing with a more or less sedentary person, saying, hey, 20 minutes a day, work hard enough that you're breathing hard for 20 minutes without stopping. And there you go. That's cardiovascular exercise. The other thing to understand about exercise and blood pressure is that it is an effect that happens with consistency over time. So exercise actually increases blood pressure in the moment. So if you go for a jog, and the minute you finish jogging, you check your blood pressure, it's going to be up because your heart's beating faster, you've got a higher stroke volume, pressure's going to be up. But if you do that consistently, you condition your body, you condition your vessels, you condition your heart, and you become more efficient. And so blood pressure as a baseline will be lower if you exercise regularly. So it has to be a consistent, regular thing. So low salt diet, regular cardiovascular exercise are things that can help with blood pressure. So initial medical management. Okay, so there, especially for you new medical students, getting out there, you're doing your preceptorships. I know it can be intimidating to go into a room, you get a history, they have high blood pressure, they're not on any medication, and you're thinking, what am I going to recommend? What should I put this person on? There's dozens of blood pressure medications, and I don't know what to do. So we're going to simplify it. I find that one of the difficult things about medicine, especially when you're first learning, is that you want to know it all. You want to know it all the details from beginning to end. You want to have this breadth of knowledge before you make any decisions. And I find that it's more helpful. It's okay if you just know the superficial first, and your knowledge gets deeper and deeper as you gain experience. So, simple things for blood pressure. 3 medications, 3 classes. So remember, 3 classes of medication for initial hypertension management. The ACE and ARBs, ACE inhibitors and angiotensin receptor blockers, thiazide and thiazide type diuretics, long-acting calcium channel blockers. 1, 2, 3. Most common medications used in those classes: lisinopril for the ACE and ARB class, hydrochlorothiazide for the thiazide diuretic class, amlodipine for the calcium channel blocker class. Now, I do want to mention the recent studies with especially the ALHAT study that specifically showed chlorothalidone has better outcomes than hydrochlorothiazide. Hydrochlorothiazide is what you see used most commonly, very easy to prescribe. It comes in convenient combinations with ACE inhibitors. Chlorothalidone has been shown to have more of an effect. So keep that in mind, especially if you're dealing with someone whose blood pressure is being difficult to manage. Think about chlorothalidone. But anyway, that's it. That's all you need to know for now. You're a third-year medical student. Those 3 medications can manage most essential hypertension patients. So people who have blood pressure just for no other reason, those 3 medicines can do it. Which one do you pick? It depends. If the individual has no other complications, no other diseases, no other cofactors, pick one. Doesn't matter. Lisinopril, ACE inhibitor, fine. Amlodipine, calcium channel blocker, great. Hydrochlorothiazide, chlorothalidone, great. Those 3 medications are good for initial management of hypertension. The only reason to pick one over the other is in certain situations. In most cases, if there's another disease process that makes one better. Okay, so for example, diabetes. Diabetics tend to benefit from ACE inhibitors for renal protection from the diabetes. So if they have diabetes and you need a hypertensive, you may as well go with the ACE inhibitor, lisinopril, or something similar. If you have a patient who has a lot of lower extremity edema and that's something to struggle with, may as well start with the diuretic because you may reduce some of that edema. The one caveat is older patients and African American patients. There have been some studies that show they tend to do better with either the thiazide diuretic or the calcium channel blocker rather than the lisinopril. Not really quite sure why that is, but that's the only caveat. You might see that on boards if you have a board question and you have to pick a medication. If it's an older person, with no other conditions, or an African American individual, no other conditions, go with either the diuretic or the amlodipine rather than lisinopril. If they have diabetes, then you're at the lisinopril. So that's initial management. I'm not going to talk about dosing a lot, at least in this video. Something that's very easy to look up and you learn as you prescribe these medicines. But hopefully that'll help ease your tension and ease your stress. So a low salt diet, regular cardiovascular exercise, and then if you're starting someone brand new on a medication, just think of one of the top three. ACE inhibitor or ARB, calcium channel blocker, thiazide or thiazide type diuretics. That's going to be enough to get you in the door. It's going to get you started as you start to manage people with high blood pressure. So I hope that's helpful. If you have any questions, I forgot to mention some of the other videos, please leave comment questions. If there's something you're like, hey, there was this study that showed this, I'm up to learning new things as well. Medicine is something that is constantly changing, improving, and so leave a question, leave a comment, we'll include it in the conversation. Have a great day. Tomorrow's Monday, and we'll get it started on a new week. Look forward to talking to you all a bit later.